to tonight's talk. I do recognize some faces. Did anyone come to my last talk? What did we do? Women's Health, I think it was. Yeah, so I'm back. I was supposed to be back earlier, but I had a strange rash, and apparently there was another presenter who had one. I found out it was from a hot tub. So yeah, just be aware. It's better than chickenpox. It did look and present a lot like chickenpox, which I did have in my early 30s, which was not fun. So I thought it was coming back. But anyway, I'm here. For those of you who don't, well, you should know what today's talk is about. We are going to discuss digestive health, the different components of what makes a healthy digestive tract. I'm imagining all of you are here because either you or someone you know or love has an issue with their digestion. Yes, maybe. Digestion is really the foundation of health. So when I see patients, we're always dealing with digestive health, regardless of whether they're coming in with overt symptoms. We really want to make sure that's, foolproof before we get into some of the other treatments. So yeah, we're going to go into that. So again, brief overview of myself. I've been practicing for, now I'm in my 9th year of practice. I'm in Kelowna, in BC. I was, for those of you who know my story, maybe you don't, I was born and raised in Victoria, did my schooling in Vancouver, and then started practice in Victoria, and then 2 years ago lost a bet to my boyfriend and had to move to Kelowna. It was a hockey bet that I lost. Victoria Royals lost to the Kelowna Rockets and made the front page of the newspaper 2 days in a row. It was very exciting, but so I moved to Kelowna in the last year, and I am still practicing there. So I have a personal interest in digestive health, of course, because like I said, it is the foundation for most diseases. Also hormone health and brain health. So we are going to get a little bit into that too tonight, just the gut-brain axis, because a lot of mental emotional disorders too do stem from poor digestion. So let's get right into it. I always like to start with this quotation because it is quite true for most of us. So all of us are humans, right? We can all eat food, but not all of us digest well. So digestion really can be a luxury for some of us. So I'm going to list a few different things that we see, and we're going to maybe cover, hopefully today. And then I want, if you are willing, to show your hands if you have experienced one or more of these. And these are all, most of these make sense as to digestive issues, right? They're happening in the digestive tract. But then we get into more systemic things, right? So malabsorption, unable to absorb some of your nutrients, can lead to a lot of other different conditions. Anxiety and depression. Has everyone heard of SIBO? Has anyone ever experienced SIBO? So we're going to talk a little bit about that too. It stands for small intestinal bowel overgrowth, and has been by many medical practitioners been theorized as the actual cause of IBS. So irritable bowel syndrome is now looked at as being caused by SIBO. So we want to treat that. Brain fog, nutrient deficiencies, inflammation, painful joints, skin conditions, and poor immune function. These, and this is not an exhaustive list, but these are all, these can all stem from digestive health, or they are digestive issues in and among themselves. Does everyone have something on this list, or familiar with some of those? Yeah. Are you familiar with this chart? So if you don't have any of those issues, but you're not type 4, you may also have a digestive concern going on that you aren't maybe aware of. So on the Bristol stool chart, we do like to see you between a 3 and a 4. He looks like he's the happiest there, right? Number 4. Well-formed. I talk about bowel movements all day long, so sorry if this is a bit made crude, but basically you want your bowel movements to be well-formed. You don't want them to have any mucus in them. Mucus indicates inflammation, just like when you have a cold or a flu. You produce mucus in your nasal passages. You can also produce that in your digestive tract. So if you ever see that, it's a good sign that you have some inflammation going on there. Of course, we don't want to see any blood. We want to see a nice medium brown color. No undigested food either. Undigested food, besides your typical corn, indicates your enzymes may be deficient. Yeah. Or that you're not chewing your food enough, which is also another concern we need to treat. And also in most cases, we do want to see our bowel movements sinking. Floating indicates too much gas in there, or not absorbing your fats. So again, a lot of information can be gathered from spending a little bit of time with the toilet bowl, if you're inclined. All right, so again, what makes up a healthy GI tract? So we're going to kind of talk about all of these as well today, just to make sure we get all those boxes checked. So first of all, we need to have adequate enzyme levels. So these are digestive enzymes that break down our food and allow us to be able to absorb our nutrients. We then want to make sure there are tight junctions between the intestinal cells. So, does everyone know that the intestinal wall is actually quite fragile? The intestinal wall separates the food that we're eating, which is potentially, it actually is the outside world. If you think of ourselves, we're like a hollow tube. The outside world is continuous with the inside of our stomachs and our intestines, right? Just one tube. So we do need a fairly good barrier to protect ourselves from the outside world, because otherwise things can get into our bloodstream, and once things are in our bloodstream, it can go anywhere. That's why a lot of food issues and sensitivities and things like that cause systemic issues. Now, our skin is another way that things can get into our bodies, but our skin layer is 13 cells thick. We have a lot of layers of skin. We only have one cell barrier in our intestinal tract compared to 13 or 14. So it's a big difference, and it's something we need to be aware of. Now, we don't have the same types of pain sensors. We don't see the inside of what's going on, whereas we can be conscious of what is going on outside of us. So we want to make sure we are doing the proper things to keep that lining intact and keep them solid, because if we have any breach, what do they call that? Leaky gut, right? So leaky gut means that those tight junctions are not working well, and are spaces that things can get through into our bloodstream and cause some of these systemic issues. We need to keep the inflammation low and controlled. So we're always going to have a little bit of inflammation when we're digesting things, because it requires work, just like when we work out, go to the gym, we break muscle cells, we're utilizing energy, but we're also creating a little bit of inflammation. So we want to make sure that we're eating a healthy diet that is full of anti-inflammatory foods, which I could spend a whole another hour talking about. And if we're eating not so good foods like lots of sugar, lots of certain types of grains, other inflammatory foods can include dairy and eggs and red meat, and not everyone reacts the same way. I'm not that typical ND that will get you off of gluten and dairy. I know it can help a lot of people, but it doesn't affect everyone. So again, just being aware of the foods that maybe do affect you and keeping that out of the system. And then also being aware that we need to break down but also excrete toxins, biofilms, and xenobiotics well, so we can deal with it, but we also want to make sure we eliminate it. That's where fiber comes in. And I'm not going to talk too much about fiber, but generally speaking, 25 to 35 or higher in grams per day is what you want to consume in fiber. I'm going to talk about biofilms. So I just mentioned biofilms there. Has anyone heard of that term? Okay, just a couple of people. Great. So I'm going to also mention that, because this is sort of new-ish science. I'm going to talk about that when we get into SIBO and Candida and some other things. And finally, we want to make sure we have adequate number and ratio of good to bad bacteria, right? Probiotics. So a healthy GI tract, we'll get into that, requires good bacteria. Do you guys know how many bacterial cells we have in our system?
More than all the cells in your body.
What was that?
More than all the cells in your body.
Yeah, actually 10 times more. So we're made up of 10 trillion human cells on average, and we have 100 trillion bacteria living in us. So they make a majority of us up. They, we would not survive without them. So I like to do that. I like to provide this stat because it does show how important they really are for us. And if we do have lifestyles or we have to go on certain medications for whatever reason that affect our good bacteria, it's really important that we do support them, because they are so important to us. A few other tidbits, if you guys like trivia, they make up to 60% of the dry mass of our feces and 4 pounds of our body weight. And there are up to 1,000 different species in the gut, but 30 to 40 of different species actually make up 99% of that bacteria. That's why you see probiotic blends if you take a supplement that are going to have, a fair number, but we're not looking at thousands here. The metabolic activities performed by our gut bacteria has also been considered an organ and called the forgotten organ. They can, function on themselves. They're very important in producing different vitamins and minerals for us and allowing us to break down certain foods. And these are some of the things that can be affected. So contaminated water or food. If you've ever gone down south or gone to a place where, you may have picked something up, it can really affect our good bacteria, and a probiotic is obviously necessary. Stress too. So stress can really affect our good bacteria levels because stress causes our blood flow to go to other parts of our body, right, besides our digestive tract. You remember the saying when you went swimming, you don't want to go swimming too close to your lunch. You eat lunch, you don't want to go swimming right after, because when you're trying to digest and the blood flow is around your stomach and intestines, you want it to stay there and do its job. If you go swimming or do something active right after, your body is then trying to decide whether it should put the blood into your muscles to be active or keep that blood wrapped around your digestive tract. So you get stomach cramps, right? That's the typical side effect. But if you do that on a regular basis, you're under stress, whether it's physical or mental stress, while you're eating, it can cause a lot of digestive issues down the road. Antibiotic use, that's a no-brainer. Obviously, those kill good bacteria as well as the bad bacteria. Non-steroidal anti-inflammatories, so that's your ibuprofen, aspirin, naproxen, other medications for pain and inflammation. Although they can benefit you, they can also cause your mucus lining to become deficient and cause microbleeds in your GI tract, which can then cause those good bacteria to be unable to proliferate properly, as well as poor diet and chronic constipation. And healthy individuals have appropriate numbers of good bacteria, but also in the right parts of our digestive tract. So we actually have different parts of our GI tract that harbor different types of good bacteria. So if you know that you have an issue with, say, your lower small intestine, you're not absorbing as many good nutrients, perhaps there's things like Crohn's going on, you would want to have a probiotic that's more specific to that part, which would be higher in lactobacillus, for example. Or if you have lower colonic or lower large intestine issues, then you'd want to choose a probiotic that has more or higher levels of bifidobacteria. We'll get into that in a moment. Okay, so again, probiotics. Definition by the WHO is that they are living microorganisms. So good bacteria that you would take as a supplement, whether that's food-based or fermented foods or a pill or a powder, has to be living to provide the same benefit that a probiotic does. Right? So it has to be alive. You want to make sure that you refrigerate your products appropriately. And when they're consumed in adequate amounts, they can provide a benefit to the host. So again, there's lots of things that good bacteria do for us. I mentioned a few already. So absorption. If you have a B12 deficiency and you're eating animal products, because animal products are the only place you can get B12, but you still have a B12 deficiency, you must look at what's going on in your digestive tract. Perhaps you have some dysbiosis, so your bacteria are not able to produce the rest of it. Other things like minerals like iron and magnesium, sugar, fatty acids. They also produce short-chain fatty acids and K2. They help to modulate the immune system. Up to 70 to 80% of our immune system is located in the gut. Again, the reason why is because we have only one cell layer there. So we need a huge army to keep ourselves protected from invaders, right? So we do see connections with people that have digestive issues, as well as people that are fairly active causing digestive issues, have more frequent colds and flus, and the colds and flus that they do have are also more severe. So again, taking a probiotic can support a low immune system. We also see that it helps with bile creation and gastric acid secretion, and they can also protect against bad bacteria. And then finally, where sort of the things that I do a lot in practice, because I do work with the brain a lot, is the gut-brain axis, right? So being aware that this is very up and coming, very exciting. We've known about it for some time, but we've just recently discovered certain things about it, right? We know that there's a literal physical enteric nervous system connecting the two. We know that different neurotransmitter components, so our brain chemicals, are made in our gut. There was even a recent study that found Lewy bodies. Lewy bodies are the one component that accumulates in brains of people with Parkinson's. They discovered that they were finding Lewy bodies in the digestive tract of these people way before the disease ever went into their brain. So Parkinson's is now considered, in many cases, a digestive issue that is going to the brain, not starting in the brain tissue itself. We also see links to obesity, pain, chronic pain, autism, multiple sclerosis, and an increase in cardiovascular risk as well. So probiotics tend to be one of those products that everyone always asks me, what are your top 10 products? Generally, a probiotic is one of them, or at least most of the time, pulsing on and off to make sure you do replenish from the loss you may get on a regular basis. And prevent dysbiosis. So dysbiosis is what we really want to keep out of our system, and it doesn't look nice. Dysbiosis, we want to have this, is it coming up nicely? We want to look like a nice shag carpet there, right? Lots and lots of good bacteria. In the other picture, you actually see our immune system. These are white blood cells, which we do not want to see on the inside of our gut. You do not want to have your immune system activated, digestive tract. That's when you see mucus in your stools, right? So really want to treat that. So being aware of dysbiosis. The other thing when we're choosing a probiotic to be aware of is our age. So children have generally a different ratio of good to bad bacteria and different ratio of the good bacteria within them compared to adults. And then that changes again dramatically as we get older. Are there any C-section babies in here? I am one. So if you're a born C-section or if you had a C-section child, although things are changing in BC for sure, those babies are not getting that first dose of good bacteria. Your first dose of bacteria, although now the theory is being tested, does come from the mother as you are being born, right down the birth canal. That's where you get your first fingerprint that helps set your fingerprint for life. If you're born C-section, you're missing all of that. You're going to get a lot of skin bacteria in your mouth, right? Because that's the first thing that's touching you. And a lot of children who are born C-section end up suffering from atopic illness as they get older. That includes allergies, asthma, and eczema. Generally, then the treatment for, if you see any of those, 1 or 3, good bacteria are important. And as you see with age, children have a much higher level of bifido in the beginning. Good bacterial probiotics, right? So if you're born C-section or have a C-section baby, even if you're an adult and you still have some of those atopic illnesses or even digestive concerns, you want to choose a probiotic that's going to be higher in bifidobacterium versus the lacto. Another thing to be aware of is where the probiotic strains are coming from. So bacteria can grow pretty much in anything. And to provide a healthy benefit in us, they have to come from one of 3 places. Human origin, which sounds maybe disgusting, but I think it was back in the 70s when these bacteria were first taken from somebody's feces, and then they are colonized. So they're no longer coming from humans, but they are originally from a human, obviously replicated in the lab, and they are guaranteed to bind to the receptors in our digestive tract. So human strain bacteria are very, very good at colonizing. They can adhere and they can make a colony. All right, so very good for post-antibiotic use. Dairy origin strains and vegetable origin strains, we know that very well. We've been using this in our lives for thousands of years through fermentation, right? So yogurt, fermented vegetables like kimchi and sauerkraut, those provide good bacteria as well that provide a benefit. They are just more transient. So if you're relying on a vegetable or dairy strain food or probiotic supplement, you'll have to supplement with that for longer periods of time because you're only providing a benefit that is temporary. So making sure your supplements that you're taking have a combination of the 3 that's going to provide you the best benefit. So there's lots of products to choose from. I'm only going to throw it, I just have the images of some of them. I'm not really talking about anyone in particular because I know everyone's a little bit different, so there's going to be lots of time for Q&A at the end. But for these two in particular, so the Ultimate Multi-Probiotic and the Critical Care Probiotic are two that I use in practice that are wonderful because they are a blend of the human, vegetable, and dairy strain. The Ultimate Multi is one that I like because it's great for the entire family. So children all the way up to the elderly can use it. The Critical Care can be used as well. However, it's much, much stronger. It's 100 billion, and that's one I do recommend because it is higher in the human strain to be used if you've been on an antibiotic. Remember that there is a myth going around where you need to wait until your antibiotic is over. That's incorrect. If you were given an antibiotic, you must get a probiotic. Even start before, that's best. Take it on the same day as your antibiotic, just 2 hours away on either side. Right? Yes. If you have one take-home message, that would be it. Because I know a lot of people, they come in, they want a probiotic, and they tell me, oh, I just finished my round of antibiotics, so I need a probiotic now. Well, they needed one 7 to 10 days ago, really, right? Because what you've done is over that time, you've killed and killed and killed and killed and killed, which is absolutely necessary for the infection, but not for your good bacteria. So you can use the antibiotic. 2 hours later, take your probiotic to replenish. And at the end, you're sort of back where you started. The symptoms, the side effects will be negated in most cases. And it also will really help prevent some really serious complications like C. difficile, right? Clostridium difficile. I see it more and more in the office, probably several times a month now, where people are being diagnosed with that. And again, it's, we need to be taking our good bacteria while on an antibiotic. Another one that I am including today, because this is very specific to anyone who may have IBS. So this particular blend is called Relief Biotic. As you'll notice, it's much smaller in strength. It's only 7 billion active cells. The Critical Care was 100 billion. But this one has been proven in this specific combination to be very, very effective at eliminating the symptoms of irritable bowel syndrome. I mentioned at the very beginning SIBO is being thought of as the main cause of IBS. This is to help provide the symptomatic benefit. This isn't going to treat the cause in most cases, so you always want to pair this with something that's going to help treat why you have irritable bowel syndrome in the first place. So it's great for people that are doing that and want to have that symptomatic support, or say they go out and they eat something that they know they're not going to tolerate. This is actually going to support with preventing those symptoms of abdominal pain, bloating, flatulence, reflux, all that sort of thing. This is a 100% human strain product, so it's very effective. And you don't have to take it for very long, right? Usually you'll feel that benefit within, the day of. But tons and tons of research on this one, which I'm not going to, tire you guys with. But as you can see, pretty much every digestive issue there, even at the very bottom, it has also been shown to support the gut-brain axis, helping with anxiety, chronic stress, depression, even sexual dysfunction. Specifically, those two bacteria, Enterococcus and Bacillus, which are 2 of the 4 strains that you see in that one. So if you tend to have the digestive issues, you also have a little bit of the gut-brain axis imbalance. This would be a very effective one to choose, and or C. diff, right? Because this has also been shown to help prevent the infection of C. difficile, 29% reduction, which is very dramatic. C. difficile is an infection in the digestive tract. Yeah. It causes, usually the symptoms are chronic diarrhea. You need to be on an antibiotic. Some people are on antibiotics for months or longer, but it can be deadly as well. Yeah, it's typically typically a nosocomial infection, meaning it's caught in the hospitals. Yeah. Because people are your immune system is so drained being in the hospital, and you're typically, in many cases, on an antibiotic. So it's rampant, plus you're weakened, and it's quite easy to pick up. Okay, so that was the first stage. So that was your probiotics, making sure that that barrier is really solid, right? The next stage is we want to make sure we're digesting everything properly. So that requires good enzymes. Enzymes break down our food. You know, we can take enzymes in different ways. We can take it with food to break it down, but we can also take it on an empty stomach to help with inflammation. That's a whole nother topic, but there is one enzyme I'm going to suggest you can do that with coming up. All raw foods have enzymes, right? So if you're a raw foodist, you like to eat a lot of raw food, you're getting lots of good enzymes in your diet. I like a couple examples here. Green bananas have a lot of amylase, right? So they have a lot of this digestive enzyme that will break down starch to glucose, and that's why the longer you wait, the darker the banana, the sweeter it tastes, because it has naturally occurring enzymes that break down the starches into sugar. Kiwis, same interesting thing. They have an abundance of a protease, which breaks down protein, called actinidin. This is why you cannot make Jell-O with fresh kiwis. So you can't use you will never find a real kiwi flavored Jell-O, let's just say that. Because the protease will degrade the gelatin, so it will never actually harden. Just some naturally occurring enzymes. And a lot of the ones you'll take as a supplement, right? If you've ever heard of bromelain, that comes from pineapples. Papain is coming from papaya, right? So we're using raw food in our supplements to support that. And now I mentioned if you take enzymes on an empty stomach, they will actually remain intact because they're not breaking down any food. There's nothing to break down. They will actually get absorbed into the bloodstream intact, and they can break down other things in the body. Nothing that's living, so don't worry about that, but anything that's non-living and typically of inflammatory nature. So systemic enzymes, or those on an empty stomach, can really help with pain, with inflammation, with congestion, right? Breaks up mucus. And from the digestive realm here, it can also break down biofilms, which I mentioned a moment ago. Bless you. So one person, I think, or a couple people have heard of the term biofilms. So this is, again, maybe a little new to some of you. Biofilms are not our friends, okay, in most cases. Biofilms are produced by infectious material, typically bacteria, parasites, and candida, yeast, fungus, to protect themselves. So it kind of looks like this as the cycle goes. So you get your bacteria that settle on your digestive cell wall, they make a family, they adhere, they create this little mucoid substance around them, and then they can proliferate without being interrupted. They mature, they spit out the active guys that will then disperse and create more of an issue. So that's why certain conditions can be very hard to treat, even with antibiotics, because antibiotics kill bacteria, they don't break down biofilm. So recurrence of infection, you want to make sure you're also looking at this. So systemic enzymes, or enzymes taken on an empty stomach, can break down biofilm. So they should be integrated into your treatment plan if this is something going on for you. Right? A chronic, I guess, C. difficile, candida. I see a lot of blastocystis hominis. I hope I'm not like going over, but if you've heard of any of these things, biofilms are very much involved. So use a digestive enzyme, but on an empty stomach for those. Okay, so back to the digestive enzymes. There's three main forms. You have carbohydrases, those break down carbohydrates, proteases break down proteins, and lipases break down fat. Basically, they long chain gets broken down, and then you can absorb those components. So if you have some of those symptoms of not healthy stools, so your stools are floating, or you see undigested food in there, right? Or if you've got really odorous flatulence, you're probably not digesting your food very well. On top of it, if you don't digest your food, it's left for the bacteria to digest. And we have 100 trillion of them. And if they start to digest our food, what do they produce? They ferment and they produce gas. And that's where you get the bloating, the flatulence, even belching as well. So making sure you're getting a good digestive enzyme. In many cases, a blend of all three is necessary. So the digestive enzyme that we normally have, right, we do make a lot. It starts in the level of the mouth. Remember to always chew, but the salivary amylase is where things start. Then things go into our stomach, where we have lipases and pepsin. You also are all aware of stomach acid. Yes, you know the stomach is very acidic. That stomach acid is not technically an enzyme because it's not a protein in nature. However, stomach acid is very crucial for proper digestion, and stomach acid, healthy levels of stomach acid actually help stimulate the rest of the enzymes in your small intestine to be secreted. So that's another thing to consider. If you're not making enough enzymes, it might be because you don't have enough stomach acid to begin with. So the pancreas downstream, which is stimulated by the acid from the stomach, we have amylase, lipase, trypsin, chymotrypsin, and then the small intestine also can secrete our digestive enzymes. Now, the production decreases with age and can be affected by a lot of different medications. The main medication we see out there that affects the rest of our digestive enzymes is the group of proton pump inhibitors or H2 blockers. So things that are acting as an antacid really affect our digestion in a negative way, even though in most cases they do help you feel better because they are reducing the symptoms of stomach acid, high stomach acid, or what you think is high stomach acid. It's actually creating quite a downstream effect, which I'll mention in a moment. Other reasons why we may need to take enzymes, well, we cook our food, right? So most cases we're cooking our food, so we're losing the natural enzymes in the fruits and vegetables. And we have deficiencies that we deal with. So whether it's in the organs or we have high stress levels, or if we're eating a lot of processed or cooked foods or canned foods, really can affect those levels. Inflammation as well, whether that's silent inflammation like cardiovascular disease or pain, just being inflamed, can really affect our ability to secrete proper levels. So as I mentioned, these are some of the challenges we see with enzyme deficiencies. So gas, bloating, discomfort, indigestion, diarrhea, constipation, food intolerances. I don't have the Canadian stats, you could probably divide by 10, but so in the US, gluten intolerance affects 18 million and lactose intolerance affects 50 million people. Now lactose intolerance is a kind of a funny thing because we are born with the ability to break down lactose very well. Because actually breast milk has way more lactose than cow dairy. So we're meant to break down lactose, but our body isn't really meant to be breastfed for many, many years, right? So our lactose levels our lactase levels or enzyme levels decrease, after the age of 3 or 4 because we're really meant to be weaned off breast milk, and dairy isn't really something that naturally we were built to digest. So it does affect 50 million US, but it's kind of a built-in thing, and so the fact that people do tolerate lactose is more of a acclimatized thing that we have now developed because we are consuming dairy. Okay, so with enzymes, there are so many different types. We're not going to get into all of these. We're going to just talk about one. So that the basics are covered. So whenever I'm starting out with someone who needs an enzyme, I just go with the basic. Very therapeutic, but it's going to cover everything. So it's going to break down your carbs, your fats, your proteins. If you have a lot of gas, you want to make sure you see high levels of a couple. So glucoamylase and alpha-galactosidase. So this formula is really great for the paleo diet, the keto diet, vegetarians, vegans, people that are, eating fairly healthy, or a lot of fibrous foods, lots of vegetables, as well as potentially animal proteins, which, a lot of people are kind of leaning to now. So again, glucoamylase and alpha-galactosidase for that legume breakdown. If you don't break down the legumes, you get that bloating and you get the gas. Essentially, that's what BINO is, right? BINO is the blend of, actually I think it's just the alpha-galactosidase, that's what that is. So if you see that in the list, you're going to help support that. So again, this one's great because it does cover everything. It's suitable for vegans because it doesn't contain any animal products. You will find enzyme products that I do recommend as well, but are coming from pancreas extracts of usually pig. So that, of course, not going to be recommended for a vegan and certain vegetarians. The other great thing about this is that it has a very big pH range, and we kind of forget about this, but as I mentioned, in our stomach, we have a very low pH. We're very, very acidic. So that means a low pH. Then when we get into the small intestine, where we need to do the majority of the breakdown and the absorption of our nutrients, that pH goes up and becomes more alkaline. But it slowly becomes more alkaline. So it goes from, like a 4 or 5, which is still acidic, to, closer to like an 8 or a 9. So the range of this particular enzyme actually is that range. So it'll help break down food all the way through. Whereas if you're focusing on just one or a couple different enzymes, you might not be able to break down your food completely. All of this stuff is, of course, important, but you will never find that really on the label of products. Yeah?
Jennifer, which enzymes do you suggest for somebody with SIBO or candida that when you're trying to take it on an empty stomach to break down the biofilm?
Great question. So that's my next slide. Did you read this before? So this one I will recommend on an empty stomach. Biofilms are not just made of protein. For systemic inflammation that I mentioned, for joint pain, congestion, you would want to focus on more a protease enzyme on an empty stomach, whereas with biofilms, you would want a blend. At least you want the starch and the protein breakdown enzymes. So on an empty stomach, meaning about 2 hours away from food, or at least an hour before you eat and 2 hours afterwards, you could take this enzyme to help break down the biofilms. We also see that on an empty stomach, it can break down food or undigested food that's just sitting there, and that can lead to, of course, SIBO again, or it can lead to candida, or it can lead to other issues of fermentation and bloating. So this is a great one because you can do it throughout the day with every meal and between meals to further support digestion. All right, any other questions about enzymes? I wish I had an enzyme right now. I had a really big meal right before.
Can you take too much?
Can you take too much enzymes? No, you can't. No. Okay, so with IBS, so we talked about irritable bowel syndrome being supported by that one probiotic relief biotic, also potentially caused by SIBO, using biofilms to help break down the SIBO. You also want to use other things to kill SIBO, and that would be, for an example, this blend here. So this is a peppermint oil with oregano and caraway. So it is, and I've used this in my practice a lot because it seems to be a bit of a magic bullet. So it can create relief very, very quickly. First of all, the peppermint oil and the caraway are carminative, which means that they calm and they soothe the digestive tract. They stop any spasms, so they help with any cramps and pain. They also help calm any bloating, so they work very, very well together that way. The oregano as well with the peppermint, it is enteric coated, meaning it doesn't open up in the stomach, but will open up in the intestine where you want it. It would be most effective, and that's where it can kill things like candida and SIBO. It is up to 100 times more effective than caprylic acid as a natural antifungal agent. So you could also use this for blastocystis hominis or other parasitic infections. So again, yeah, here I wrote some things down for SIBO, if that's true for any of you here, right? Peppermint oil in combination, usually with prescribed antibiotics, is the treatment protocol. So you do have to work with a naturopath that has prescription rights, or your medical doctor. If you do have SIBO, these are just little tidbit pearls here, no probiotics are actually necessary until you eradicate. So I mentioned always take your probiotic with your antibiotic, or at least on the same day. Not the case for SIBO. If you are diagnosed with it, you need to kill that bacteria before you start putting new bacteria in. So as I mentioned, SIBO is a small intestinal bowel overgrowth. It means that the good bacteria that you have is living in the wrong place. So it's not really a true infection because it's supposed to be there, but it's not supposed to be exactly where it is. And it could create a lot of IBS symptoms. And then, of course, we've got the different diet plans that people will follow, the SCDs, the low FODMAPs, and then the GAPS diet, which again, we could go into for hours. Okay. So that was sort of the IBS protocol there. Now we have to remember that barrier. How do we keep that barrier healthy? How do we protect or treat leaky gut? So you can see there's that yellow, the yellow line here. This is your intestinal cells, the cell barrier, one cell layer thick. This is everything you're eating. This is all your good bacteria. This is the mucus layer, and then this is the inside of your system. So the best thing to take to repair a leaky gut would be the direct fuel source for those intestinal cells, and that fuel source is L-glutamine, which is an amino acid. Okay, it is actually the most abundant amino acid in the body. So it seems strange to think that how could we ever become deficient in it? Why can't we get it from somewhere else to feed our good bacteria? Well, it's also used in our muscle cells. And again, as I mentioned, people that are very, very active, so marathon runners I see mostly, and people that exert themselves, even people with very, very physical jobs, firefighters and things like that, people in the military, have more frequent colds and flus and that are more severe because the glutamine that they do have is being shunted to their muscles, not feeding their intestinal cells. Then the immune system becomes weak and they're more prone to infection. It is actually produced by our muscle cells as well. So it's going to be utilized first by them because that's where it's coming from. And it will be released when absolutely necessary to other organs. Now, L-glutamine, as it shows there, is made by us, right? We can make it, therefore it's not called an essential amino acid, right? Our essential amino acids are those that we can't make, we have to get from our food. But this is the most commonly conditionally essential amino acid, meaning under many different conditions we have to consume it externally because we become deficient in it. So during long periods of stress, infection, prolonged exercise, surgery, right? Really important if you go into surgery or coming out, because it's great at wound healing as well. Very easy to take, right? It doesn't interfere with any kind of medication. So it's that food for our enterocytes. It supports our immune system. If you get sick every year, you can sometimes get away with taking glutamine and a probiotic. You don't need your antiviral and your oregano and all that sort of stuff. This often is the foundational, guide to keeping that immune system healthy. It's also an anti-inflammatory, which again is why it's in our muscle cells, helps to reduce inflammation after working out or being athletic. It's an antioxidant, and it also helps to balance pH in our bloodstream, keeps us alkaline. Right? We do not want to have acidic blood, we want to be more alkaline. So glutamine, very important. So again, where do we give it? Any kind of GI stress to stabilize that barrier. If you're recovering from illness, stress, or trauma, if you're an athlete, it can minimize the side effect of many different cancer drugs. It also helps with diabetes. It enhances insulin sensitivity. One of the main things I give for any kind of alcohol addiction or sugar addiction, I should say, very effective. I don't typically give the big tub of powder to people who need it that way. I just give the capsules. They open a capsule anytime they're having a craving under the tongue. That craving will go away in about 5 to 10 minutes. Why? Because glutamine is another fuel source for your brain. And when you are going through an addiction crisis, or you're going through a craving, providing a little bit of energy right to the brain, not going to the alcohol or the sugar, will curb that. So very, very good. You don't need to carry the tub around, powder in there, right? That's why the capsules are good, because you could just open them up, no flavor, right? Just under the tongue. Good for mood disorders and high stress, and for the elderly, because as we get older, we start to break down muscle tissue, and the muscles where our glutamine's coming from. So typically need to supplement that way. So as I mentioned, I do prefer the powder, because you're going to get the correct dosing that way. For any of those things besides that addiction protocol, you want to be taking anywhere from 5 to 10 grams. So that would be 10 to 20 pills. Not really that effective. So taking a powder. When you take a powder, you want to make sure it's micronized. So you want it to be small, meaning it will be absorbed much more readily into those intestinal cells to feed them. From a natural source, this one's coming from fermented beets, so coming from nature rather than synthetically produced. And you can really take it at any time of the day. It absorbs well in water. It doesn't have to go in any fancy flavored drink or smoothie. You can take it with other things. If you are, however, athletic and you're taking it to boost your glutamine immediately after a workout, best to have that alone with water. Just take your shot of glutamine and water, and then maybe, half an hour later you can have a meal. Otherwise, if you're just taking it for regular support for digestion or post-surgery or stress, any time of the day will be fine. All right, so that's how you would help to treat the leaky gut. So we've kind of covered a lot of these things already. So we covered, dysbiosis that can cause leaky gut, enzyme deficiencies. Now, if you have food sensitivities or allergies, obviously you should get tested for those and then remove them out of your diet. Drugs and alcohol and stress, really, not really a supplement that treats that. That's a whole other realm of things. But they can all cause that local inflammation in the GI tract, which leads to the breakdown of cell junctions. That's why you want to take the glutamine. And losing the loss of good bacteria, you want to provide probiotics for that. Because if you do not do that step, then you're going to go into that systemic inflammation, gut-brain axis, all those other things I mentioned, right? Joint pain, depression, anxiety, hormone changes, you name it. So to keep that inflammation down, and I may have talked about this product before, it's one of my favorites. I pretty much recommend this to every single person because inflammation is at the core of pretty well every disease out there. So whether it's digestive or not, curcumin is super effective for pretty well everything, for prevention and treatment. So curcumin is that active constituent added to turmeric root, right? You see that there. Turmeric root been used for thousands of years as a food, as a medicine, and as a dye. It has been found to contain many different constituents, but curcumin is the single most studied and researched one out there for its role in inflammation. And it was considered the molecular and preclinical cure-all because curcumin was shown in research to literally treat everything. Now that was more in cell studies and animal studies. We found it a little bit more difficult to replicate that in human studies. I'll get to that in a moment. So of course, lots of different digestive health functions because it's an anti-inflammatory, it's an antioxidant, prevents protein aggregates. So that's where you're going to find that benefit for things like those Lewy bodies in Parkinson's, right? We do, I give curcumin to anyone that has dementia or Alzheimer's or Parkinson's. Curcumin also crosses the blood-brain barrier. So I have a whole other spiel on brain health. And again, curcumin is one of my main products to prescribe in that. Also helps to chelate heavy metals. So we're consuming heavy metals on a regular basis, right, in our water. Batteries down. It's on. It's flashing. Well, we'll see how far I get. Or do you want to replace it? It's still working. We'll go as far as we can. I just, did the little shake of the batteries. It came back on. I might even have. Okay. So what was I was speaking about? Oh, heavy metals, right? If you enjoy tuna, or if you have amalgams in your mouth. Mercury amalgams, right? Silver fillings, huge reservoir of mercury. So every time you eat something warm or drink something hot, you enable mercury, right? It becomes vaporized. And, well, the brain is very close to your jaw. So you don't want to really be too exposed that way. And tuna, again, and other forms of fish, right? The larger fish have quite large reservoirs of heavy metals like mercury. So consuming something on a regular basis, if you have that or if you are consuming tuna, will help to chelate, to bind up those heavy metals and get them out of your body so that they don't go into your tissues. Curcumin is also a detoxifier, very good for supporting the liver, and regenerates neurons. So again, that's why I recommend it for any kind of brain degenerative disease. So, as I mentioned, preclinical cure-all, very big title, mostly seen in cell and animal studies. because curcumin is very hard for humans to absorb, right? So it's very difficult for us to get from the gut into our bloodstream. When we do, it's metabolized quite quickly, can be cleared very rapidly. So when we're trying to take curcumin to have a benefit, 20 years ago, we were having to take many, many pills or, grams and grams of turmeric root to actually provide any noticeable difference in our bloodstream. There's also many different types of curcumin. So even, I'm sure there's a curcumin section here. You'll see, I was in another store that counted 25 different curcumin and turmeric products because over the last 20 or 30 years, scientists have been trying to make curcumin more absorbable. So you'll find, the traditional forms, which is just your straight turmeric, all the way up to things that are water soluble, which are the most absorbable forms. So just being aware of, if you're wanting to take curcumin, get an absorbable form, or take more capsules of a less well-absorbed form. And this is where I get into Theracumin, just because it's probably my favorite supplement right now on the market because of its ability for it to get into our bloodstream. So Theracumin is much, much smaller, first of all, and it also disperses in water. So if you were to ever, and I usually do this as an experiment, but you can literally open these capsules and pop them into water and it'll turn into a bright, nicely, yellowy orange solution that you can drink. There's no flavor at all, right? We're not talking about turmeric, the spice. We're talking about curcumin, the extract. So really great for people that can't swallow pills. I use it in animals, give it to my dog whenever he's, the last time was when he was neutered. He's not that old, but when surgeries or pain or inflammation in animals, they respond really well to things like this. It's extremely safe and there's no toxicity. So again, it's not on the label, but it's smaller doses fine in children too. The real reason why I recommend it is because you don't have to take very much to get a calculated amount in the bloodstream. So if you want it for that systemic inflammation, you can take anywhere from 1 to 3 capsules and you can get an extremely high value, which compared to some of the traditional forms, brand D here, I don't even know which form this is, but you're taking 16 pills or something like that to be equivalent. So being aware of how absorbable the form of curcumin you're taking is important. Now, if you're doing it for just digestive health, just in the colon or in the intestines, you don't care about it getting into the bloodstream, then you can go for a less absorbable form. That's where I go to just straight turmeric root, right? Just the spice, add that to your smoothies, or take a combination of turmeric with bromelain, something like that. You don't have to take tons of it, but it's going to do its work here and then go out. It's not going to actually go into your bloodstream. So there is benefit to both, but if you are looking for actual systemic inflammation relief, you do want one that is more absorbable. So you're looking at 2 to 3 capsules per day. Okay. Some of the recent publications, which I'd just like to discuss because it gets us into the gut-brain axis with water-soluble curcumin is cognition. So they have found that Theracumin itself, water-soluble, crosses the blood-brain barrier, has been shown to reduce beta amyloid production. Amyloid is what accumulates in the brains of people with Alzheimer's and other degenerative diseases. They actually, one study concluded, a very strong statement, but they concluded that there was evidence that this form of curcumin may untangle brain lesions and there was a potential for reversal in early stage Alzheimer's. Again, a very, very strong statement, to be aware of. It's not, again, your magic bullet for dementia or Alzheimer's at all. However, if you do catch it early, we are seeing dramatic improvements. Major depression as well. It helps to reduce these same enzymes that a lot of those antidepressants are working on to help to raise the levels of serotonin as well as dopamine and norepinephrine. PMS, for any menstruating women in the audience, if there's any in here. Really cool. This given 10 days before and 3 days after menstruation, so for about 13 days. reduced PMS after taking it for 3 months, reduced PMS by almost 60% compared to placebo, which is only 14.5. So, and this is only, normally when I talk about this product, there's pages and pages and pages of research because it's so absorbable that universities and colleges in the United States and in Canada are picking up on this product because there is such great compliance. You can get 500 people to take 2 capsules a day for 3 months, where it's very hard to have them take 10 to 15 twice a day to show that effect. So that's why we're seeing so much more research come out with curcumin and general health. Okay, now with the leaky gut, back to the leaky gut, the other nice thing you can do is you can get in combination your glutamine and your theracumin. This is what I use after I work out because I tend to work out for a while and then stop and then go back to it and then get really, really sore. So this particular product is excellent because it helps to reduce that muscle soreness, it helps reduce that inflammation in your body, but also provides the glutamine for your muscle health. And so vice versa in the gut, if you've got inflammation in the gut and leaky gut, this is going to be extremely effective as well. Very easy to take. It's in powder, and you just add that to water. Okay, so last but not least, I feel we're kind of going in the opposite direction here, but I wanted to kind of finish with one of the more therapeutic products that not everyone has. Maybe, most people I think are coming in with lower intestinal issues, not so much gastric health or stomach issues. So we'll start with raise of hands. Anyone ever had heartburn? Okay. And did anyone ever have heartburn under the age of 30? Oh, nice. One person. Okay, so it's true. It does happen as we go older. Does anyone know what the real cause of heartburn is? Yes, not enough stomach acid. Good. Okay, so let's get down to basics. The stomach is a pH of about 1 or 2. Very acidic, right? The lower the number, the higher the acidity. It's meant to be there, right? Because it kills things that we're being exposed to, bacteria, parasites. It helps break down protein, and it gets the rest of the digestive tract ready because of that pH. It also allows us to absorb different things. So minerals, iron. If you ever have an iron deficiency and you can't figure out why, or you are taking iron and it's not supporting your levels, you probably have low stomach acid. Magnesium as well. You need proper levels of acid to absorb your magnesium. Symptoms of magnesium deficiency, eye twitches, right muscle cramps, palpitations, poor sleep. We're all pretty much magnesium deficient, let's just say. And then B12. B12, you absolutely need acid to allow for that absorption. So as we get older, or we're under more stress, or we're on medications, our stomach acid can be affected. Now, this is new to some people. The major sign of heartburn, or the major cause, I should say, of heartburn is low stomach acid, not high stomach acid. However, if you've had heartburn and you've gone to most clinics, you're going to be prescribed an antacid, which is going to lower your acid even further. So you're not doing yourself a favor. You are definitely improving your symptoms, right? It's very good for symptomatic relief. If you read the therapeutic initiatives, or if you read or you talk to any pharmacist, you should never be on an antacid for more than 2 weeks. And every doctor knows that. But I've had patients with being on it for 40 years. So it's a big problem because it's also hard to get off sometimes. Heartburn is not pleasurable, right? So it's very easy for us to want to continue to keep that level low. Now, if you have Barrett's esophagus or some other complications, you will want to be on an antacid. So there's a little bit of caveat there. But generally speaking, as we get older, we don't make enough stomach acid for many reasons. And what that stomach acid is necessary at doing is keeping the sphincter, so that in between the stomach and the esophagus is a sphincter, a very tight ring of muscle. That tight ring of muscle has to stay tight to prevent the acid from coming up. It only opens when we're swallowing food, and then it should close again. But the signal for it to stay tight is acid. So if you don't have enough acid, you're going to have a loose sphincter, and the acid or the digestive contents that you do have, which is still acidic, but not as acidic as it should be, will then come up. And that's when you get reflux, and that's when you get heartburn. So the treatment typically for heartburn is to give acid. So apple cider vinegar is a great start with meals or as a supplement, or you can go as far as taking betaine hydrochloride, which is stomach acid. It's hydrochloric acid coming from beets. Now there are a small percentage, if you're under the age of 30, it's kind of a generalization, but there's about a 10% of reflux or of heartburn that is actually caused by high acid levels. So if you ever do try one of these two things and it makes it much worse, or you get a warming sensation that doesn't really go away when you take this with food, always with food, if that warming sensation or you get that heartburn come back, your levels probably are actually normal or high, and that's when an antacid would be beneficial. But as I said, it's typically a small percentage of the population and in younger groups of people. The other importance of acid, as I mentioned, is to kill bacteria. And we do have one particular bacterium that lives in most of our stomachs, but can cause infection. And you know what that one is? H. pylori, right, in our stomach. So if we have not enough stomach acid, that bacteria can actually thrive and burrow into the lining of our stomach and create an ulcer. In those cases, if you have an active lesion or H. pylori diagnosed, you want to do a few other things before you start adding acid. You don't want to put like lemon in your or acid in your cut, right? You want to heal the ulcer and you want to get rid of the infection. So if you have been diagnosed with H. pylori or you have an ulcer or lesion is suspected, there are other things you want to consider before. And this is the last product I'm going to mention, and that's called Gastro Assist. It does help with the rest of the digestive tract, but it is most specific to the stomach. Okay, so let's get into why it works here. So it has a lot of different things in there. I'm going to mention the 4 main reasons why I use it in a second, but basically it has antibacterial effects to H. pylori. So it has mastic gum, which kills H. pylori, also soothes the digestive tract, specifically the stomach. Zinc L-carnosine, very important nutrient. This is what will heal the lining of the gastric, or the stomach. So not so much glutamine in this case, but zinc L-carnosine. The other components in this product is one type of bacteria, Bifidobacterium longum, BB536. A specific strain has been shown to help eradicate H. pylori. Saccharomyces boulardii, which is actually a yeast that does not contribute to yeast infections or candida or fungal infections. You don't have to worry about that, but this helps literally to grab bad bacteria and parasites and pull it out of the system. Very good for traveler's diarrhea. And chamomile, so that's going to help soothe. So this is a really nice combination. It's a very therapeutic product. It will heal that gastric wall within about 6 weeks. So you do want to be taking this particular product for 6 weeks. And the recommended dose is 4 per day, because you really need to have, most specifically, enough of that zinc L-carnosine to heal that tissue. So when I use it, the main indications would be, again, heartburn, GERD, or H. pylori. If you've been diagnosed with any of those. Traveling, so as a preventative and as a treatment. So it's got that good bacteria to replenish any bad bacteria. It's got the Saccharomyces boulardii to kill or to get rid of that bad bacteria. If you have an antibiotic or take an antibiotic, same thing. You want to have replenish the good bacteria. You also want to get rid of any bad bacteria that may grow because of the antibiotic use. The chronic NSAID as well, because if you're taking regular ibuprofen or aspirin or what have you, you create microbleeds. right? We were actually taught, so NDs in BC have prescription rights. So when we were taught by the medical doctors and the pharmacists, when we were getting our certifications, you know, they said, even if you've had one NSAID one time, you caused a microbleed. It doesn't accumulate, it's not that it accumulates, it causes a microbleed every single time. Typically you heal up, no problem. But if you take a lot and for long periods of time, you cannot compensate. So it is happening every single time you take one of those pills. So healing, keeping that gut healed so that it will prevent complications down the road. So again, very, very therapeutic product for stomach support. Okay, so to kind of finish today's presentation, another couple take-home messages, of course, is the cause is really important to determine when you're looking at digestive health, because there's so many different things that can be going on. It's one of the most complicated systems in our body. It is also one of the most important systems in the body because it affects all of the other organs. So in cases like this, if you've been diagnosed with C. diff or UCIS, to get tested for these sorts of things to really determine what is going on for you. Individualized medicine is where things are moving. I don't know if any of you have a naturopathic doctor, but that's sort of what we focus on, right? We don't get 8 minutes with you, we get an hour. We're working with you, not with your disease. So testing is another way to really determine what is going on. I include this because I think, because when I've shown this before, people are really intrigued, it's really cool. But you can actually get, you know, your stool assessed, right? You can poop in a container a couple times, and you can send it off to labs that will literally test and tell you what good bacteria you have and what you don't have enough of. And then you go get your probiotic to replenish what you need. This patient, this is an anonymous sample, but this patient had very low levels of lactobacilli. So small you can't read it. Lactobacilli and enterococcus were low, which are the two out of the four in that relief biotic I mentioned. So that would be, you know, for example, something that I would recommend. This person also had a lot of commensal unbalanced flora in the yellow column there, so we'd want to work on getting rid of that. And they also had some dysbiotic flora down here. If this lab, for example, finds some bad bacteria or bad yeast, they will actually take that and test several different natural and pharmaceutical antibiotics and antifungals and tell you exactly what your infection is susceptible to, which is also very cool. So in this case, this person had that candida that's susceptible to grapefruit seed extract, but didn't respond to oregano at all. So right, if they'd come in, I might have suggested oregano oil. Wouldn't have worked for them. Berberine didn't work for them, right? The caprylic acid and the grapefruit seed extract. But they're also susceptible to several medications as well, so if we wanted to go that route, we would give them a drug. Regardless, I'm just mentioning this because it is important to be aware of how you're feeling, the different ways your digestion can be off, other manifestations, right, of digestive issues, including things like, almost made it.
You know what, I think the battery is dead on that phone.
Just give it a wiggle and it works. You there? Oh, yeah, okay. So being aware of how those are manifesting in you, because it's not a recipe. I just suggested a bunch of different products that may or may not work for everyone in this group, right? So just being aware of that. And also product quality. So I'm biased, right? I always like to choose things that are Canadian, personally, and local. Natural Factors, which is one of the companies that I educate for, is from BC. We have over 1,000 acres of organic farmland, which is where we get a lot of our fruits and vegetables that are in our malties and our herbs and our, you know, all sorts of things. So that side of things as well as contamination. It's really important to know that you can trust a product. In Canada, we are very lucky because we have very strict guidelines with Health Canada, but making sure, you know, we're not taking something that's going to do more harm, right? Contaminant testing, testing for GMOs. The Assura emblem is a great one, right? There's other different, there's other ways of testing products, but basically knowing that your product is at least going through some sort of third-party facility, you know, is that a whole other side of supplementation. So I'll finish there. I will really finish there.